As parents, the common doubt they have is my child ready for surgery? So, whether the child is ready, whether the family is ready, it is totally a family call after a pediatric surgery consultation, telling that whether he is ready or whether the family is ready or whether they are ready to take it up. So, there will be so much of background homework which need to be done by a family and the mother especially, and of course the kid also. So, kid also should be ready to take it, and in this journey, I will be hand holding you, and then as pediatric surgeons, we'll be telling you how you should be progressing with the process of undergoing a surgery for a very precious child of yours, that is your kid. So, whether he's ready or not. So, can we ask the child? Can we ask the family? Can we ask the mother? So many people need to answer this question. So, two things are very important. One, is the kid's physical health ready for the surgery? And is he physically fit or not? And second thing is emotionally a kid or a family ready for the surgery or not? So, if at all, if it is a small child, yes, whatever parents say, it goes. But if it is a slightly elderly kid, so kids' involvement is very, very, very important. So whether kid is ready physically or not, that anesthetist will tell whether there is a physical clearance. So by doing what is called as a pre-anesthetic checkup. This I'm going to come in the tell in the coming slides. So doing a safe surgery for every child is a pediatric surgeon's dream, and pediatric surgeons will make it possible. And this year, actually December 29th, is our pediatric National Pediatric Surgery Day. So on this day, this is going to be a promise from all the pediatric surgeons. And if at all, if any surgery is required, so I plead to all the parents, come and utilize the pediatric surgical services nearby. Every hospital has got, every place actually you will find a pediatric surgeon, which you know how to access, how to Google them. So find out and go to a pediatric surgeon because he's a kid. He needs a surgeon who is specialized in kids. That is a pediatric surgeon. So, so expert hands are meant for tiny patients. So utilize pediatric surgical services. So any surgery, is it safe? This is the first question parents of the family should answer to themselves. Then they should get prepared for the surgery. So nowadays the pediatric surgery surgeons, many numbers are there, and we are specially trained in pediatric surgery. After around 3 years of general surgery, we'll be doing 3 years of super specialization in pediatric surgery, where we'll be taught how to deal with delicate, tiny hands, tiny babies, and how to handle them. Frankly speaking, if you ask a pediatric surgeon, well, will you do a general surgery or adult operation? So I'll be so uncomfortable because adults will have so much of fat. They're so big, so massive, and pediatric surgery, actually, we are so well tuned in doing this fine work only. And we'll be doing the touching and handling only pediatric babies. So, starting from newborns to teenagers, we handle all of them very carefully, gently, and with lot of precision, and literally with zero problems. So, pediatric surgeons, along with them, actually, the main co-doctors who will be dealing with our babies are pediatric anesthetists. So pediatric anesthesias developed significantly in the in the last 2 to 3 decades. So frankly speaking, this is my third decade of pediatric surgery practice. In this third decade, and what I have seen before, there is significant change in pediatric anesthesia. Nowadays, we are getting pure pediatric anesthesia doctors who will be handling the babies and giving the best of the best possible anesthesia to the babies. That is beauty. And with this combination of a pediatric surgeon and a pediatric anesthetist, and along with us, our pediatric ICU team, neonatal ICU teams, all these things, we are able to give the best possible care for any tiny baby. Actually, recently we have operated on one 600-gram baby, and sometimes we'll be operating on an 18 years old child. So all this is a wide range, and but each and every baby requires a specialized hand and a specialized eye, which a pediatric surgeon has. So they and added to that. the tools that we are using. In pediatric surgery, the tools that we are going to use are so tiny, and the threads that we use are also so tiny and very thin. And almost actually, sometimes you can compare it with your hand. So to handle those type of suture materials and equipment, uh, you should be using them daily, day in, day out. So as pediatric surgeons, we do this thing every day. That's why we know very well and what type of tool to use for which type of patient, what age of the patient, and according to the delicacy of the delicate handling of which is required for that baby. So to add to this, minimal invasive surgery means be it laparoscopy if you are putting it in the stomach or abdomen, and be it thoracoscopy if you are putting it in the chest. And sometimes we do vesicoscopy, means we put scopes inside the urinary bladder and we do urinary reimplantation, major operations. And over and above this, actually, we got recently pediatric robotic facility also in Kim's Cuddles. And I'm proud to tell that actually Kim's Cuddles is the first pediatric hospital to start pediatric robotic surgery. And we are giving, according to the eligibility and the criteria of the patient, we are giving the what suits the best to the child. Is it an open operation? Is it a minimal invasive surgery, laparoscopy, thoracoscopy, or is it a robotic surgery? So it is purely a pediatric surgeon decision, and of course, with parental consent, what they want. That is also equally important. And for every surgery, actually, we have what is called as a safety protocol. In fact, WHO has given standard recommendations what all to be there in the safety protocols. Whenever you're doing any surgery, for kid surgery, it is still more important. We have what is called as a time in, time out, and the surgery discussions will be going on whether we are doing means whether this child's name is perfect, correct or not. So someone on the floor will be asking the surgeon, is the child name correct? And they'll ask, what is the procedure? Then I will be telling the procedure. Is it the correct site? And they'll ask actually, is it right side or left side? Or is it in the midline? And with all these things, actually, we are going to give 100% sure, confident, precise pediatric surgical work. So this is what is included in our safety protocols, and this is all to ensure that actually there are zero errors in the kid surgery. So when is surgery necessary? Is the surgery timing? Actually, should I be doing this surgery now or should I be doing it later? Frankly speaking, a pediatric surgeon will tell actually what is the right time to decide. So, for example, in the antenatal period itself, means when the baby is in the womb itself, sometimes fetal diagnosis will tell this child has got this problem. So that problem sometimes actually it should be operated as soon as possible. The moment the baby comes out, literally we'll be preparing and we'll be counseling the family again, and then we'll be doing the surgery. So that's why I always tell that antenatal counseling for these problems diagnosed when the baby is in the womb itself is very, very, very important. That is because parents and the family know exactly what is going to happen to the child after the birth, because that time maternal stress will be there, paternal side of stress will be there over the time. Baby with a correctable malformation is also there. So that time it is not a time for us to counsel and discuss about what are the problems involved with the baby and what to do. So that's why good planning. So always in life, I always tell all my colleagues. So good planning is very important in each and every step. What should be the next step? How I should be proceeding with the next step? This clarity should be there in every human mind. So as antenatal counseling will literally prepare a family for this plannedness for doing this procedure and timing of this procedure also. So some problems, something like there's a block, intestinal block. So the absent anus is not there. It is called as imperfect anus. For these type of conditions, we do an operation as soon as possible. And for some conditions are there, some like a hydronephrosis, a kidney swelling is there. So we'll be following it up after 3, 4 to 5 days one scan. After that, we'll be doing a repeat scan after 1 month. After that, we'll do some tests, and then only we'll plan for the surgery. So this timing of the surgery is very important, and pediatric surgeon is going to discuss with you about all these problems, all these timings, and all in detail in your consultation. So all what and there are emergency situations like how I told, and there are some surgeries where Just it is only for improving the quality of life. For example, actually the child has got some keloid or some abdominal swelling. So that because it is some little bit of disfigurement, this is a little bit of uncomfortable feeling. Only for that reason we'll be doing the surgery just to improve the quality of life. So those are also actually to be considered, but they are very much elective operations. They're not emergency operations. So one common question parents will ask is, Doctor, actually, I heard that anesthesia is not safe. Will my baby take the anesthesia or not? Which type of anesthesia do you give for my child? But kids usually they require full body general anesthesia. That is because actually when we are putting a needle or a knife, if the child moves, actually that it can be more disastrous than giving a general anesthesia. So that's why most of the procedures are done in general anesthesia because we want the baby to be calm. Why the baby will be uncalm means it is mainly because the patient child is in so much of apprehension. Suddenly, we are as doctors will be taking them into a sterile area, which is operation theater, where parents are not allowed, where new nurses, new doctors, new colleagues, new people in different scrubs will be seen. So all these things are a little bit of scary environment only. So to prevent the baby from getting scared because of this environment, we try to put the baby to sleep. That is what we call it as anesthesia. In anesthesia, also, actually, some people will be asking, will you be giving a short GA or a proper GA? But general anesthesia is general anesthesia. Whatever they give, whether it is sedation, means the anesthetist, pediatric anesthetist, they know exactly what to do and how much to give. So they means they, in fact, actually, they'll ask the surgeon, doctor, how much time are you going to take? And otherwise, also, they know this pediatric surgeon is going to take half an hour for this case. This pediatric surgeon is going to take 1 hour. This pediatric surgeon may take 2 hours for the surgery. So according to the anesthesia time, they'll be planning surgery time. They'll be planning the anesthesia time, and then they'll be giving. So as you can understand from what we are trying to tell, there is so much of coordination required by the pediatric surgeon, pediatric anesthetist, nurse, and the ICU doctors and the intensivists. So, and in this constant monitoring will also be there, and anesthetist literally, we often compare anesthetist with the octopus because literally he should have eight hands. So literally, they'll be seeing actually everything. They'll be seeing the monitor, they'll be seeing the baby, they'll be seeing the surgeon, they'll be seeing what is happening actually, whether all the things are moving in the correct thing or not. And if at all, sometimes if we don't have a proper illumination, the vision, so they'll be assisting a doctor, actually a surgeon, and guiding the surgeon in showing what exactly we are doing. And at the same time, a clever anesthetist, usually all the pediatric anesthetists, they'll be seeing what is happening during the surgery also. Means whether things are going smoothly, whether anything is required. Suddenly, if the bleeding is more, a anesthetist, good anesthetist, pediatric anesthetist, will tell, please, doctor, sister, arrange for some more blood. So this is how the smart our pediatric anesthetists are there, and we are very grateful to them because of them only we are able to give the successful results. And one thing actually all the parents should know is what are all the questions that they should ask the pediatric surgeon when they are sitting in front of me while doing the consultation, pre-operative consultation. So that is very important. So whether the surgery is important right now that we discussed, and what are the risks of doing this surgery while doing the surgery and after the surgery is over. Sometimes some surgeries are associated with more bleeding. So if at all, if necessary, as surgeons will plan, and we'll be arranging some blood before only, and then if we'll be using only and when if it is necessary. If it is not necessary, we usually don't use that. So, and a thing you should understand is actually uh, how many days you may have to stay in the hospital for that. And usually, at least some surgeries are done day in, day out. We know the numbers also, how many we'll be doing. Some surgeries are really rare. So those surgeries actually will be doing with more meticulous care and more precision. And usually, most of the parents ask is, Doctor, can I stay with the child for some more time? In fact, actually, if a chance is given, a mother will be very happy to stay with the child inside the operation theater also. But unfortunately, operation theater is a very sterile area where usually we don't allow the parents to come beyond one red line. So usually, if you see in the operation theater, there will be one red marked line. So beyond that, you are not supposed to enter if you are not very clean, if your dress is not very clean. So that's why the slippers that we are using will be different from that line and this line. They'll be totally different. So that much of meticulous care and precautions will be taking while performing any operation, so that your child should not get infected because of these extra unnecessary reasons. So that is the main reason why we'll stop parents at one level and we won't allow them to cross the thread line. So this is what I am trying to tell, that infection. Infection is very important. So, like how we are not allowing the infections to come inside, same way kid also should be infection free. So, if at all, if the child has got some cough, cold, fever, and if these things are there, usually we'll ask the parents to inform us well ahead so that we won't plan the surgery in this time if it is an elective operation. But unfortunately, if it is an emergency operation, yes, irrespective of all these things, pediatric anesthetists will take extra precautions. And of course, along with that, actually, a little bit of extra risk will be there. So, in elective operations, we won't take any risk, unnecessary risk. But in elective operations, actually, if at all, if chance is there, we'll try to postpone. But if it is emergency, yes, we will take the risk and then we'll go ahead with the procedures. And usually, if at all, if any of these things are there, the post-operative period will be very difficult, mainly because while giving anesthesia, your lungs should be perfect. Means it is like doing a very highly challenging task. So kids, we are dependent very much on the kids' lungs, more than the instruments and bags and ventilations that we will be using. That is only temporary. But after that, the kid should recover and then he should do that full work by himself with these lungs. That's why lungs are very important when planning any surgery. So, uh, but my sincere advice, if at all, if any of these things are there, please don't hide from the pediatric anesthetist or from the pediatric surgeon and then straight away cancel the case. And the other important thing is fasting status. So, any operation when we are doing, uh, everything will be relaxed, all the sphincters will be relaxed. So, so our food won't be coming up, whatever we ate, because we have one sphincter at the gastroesophageal junction. So this also will be relaxed actually when we are giving anesthesia, full body anesthesia to a child. So we don't want these contents to come up and then soil our lungs. So any spillage of this food or anything into the lungs is going to lead to what is called as an aspiration pneumonia, which can be sometimes life-threatening. So that's why we insist. 10 times we'll be asking. Actually, NSS will ask 10 times. They'll ask actually, did you eat anything today? Did you drink anything today? So don't hide anything. So be frank. Tell by mistake actually if the child eats also. So that's why, as a observant mother, you should be observing and saying that the child doesn't eat anything even during this waiting period. Kids are naughty, kids are hungry, kids, they are used to eating as and when they feel hungry. So that's why observation is very important and see that he doesn't eat or drink anything in the prescribed time that a pediatric surgeon gives. So that is very, very important. So for some surgeries, 2 hours isn't for enough. For some surgeries, 4 hours, some surgeries, 6 hours. Some surgeries actually where there is some gastric emptying delays. So already some stomach operations are done, something like a gastric pull-up or something will be done. For those conditions, actually, we'll be giving more fasting status also. So doctor, pediatric surgeon, and the pediatric anesthetist, they know exactly how much of ambient status is required for your child. So please maintain that strictly and sincerely follow the doctor's advice. And this is the most important word of caution that I want to give everyone. So we have one emotional checklist also. So emotional readiness from the child is very important, and it completely depends on the age. So 1 year old will be totally different, and 18 years old will be completely different. So how we have to deal with these types of kids of different ages, I'm going to come up in the coming slide. And whether your child is ready or not, and what is going to happen to him, and all these things are very important, and only then actually he'll be mentally ready to come and join us in this big process of surgery for the child. So for example, actually according to the age group, I have differentiated, actually I have made up actually this chart. And So if you see a 1 year old, actually, frankly speaking, he doesn't require, all he requires is little bit of mother's cuddling and mother's love. So with that, they'll be able to understand. Yes, little bit of crying will be there during the separation anxiety, but soon, this is only for few seconds. So within few seconds, the child will be very comfortable. And suppose if it is a slightly bigger child of 1 to 3 years old, so maybe 1 to 2 days of preparing this child is enough. All that he requires is little bit of comforting the child, and you can tell him, actually, we are going to take you to the doctor. Actually, doctor will put you to sleep, and then we'll be there only. We'll be waiting for you. We'll be taking care of you, and the moment, and we'll be there. So that we will be there. We will be there. Actually, I am there and holding that hand. These are important for these type of kids. And something like a preschool child, actually something like actually one who is going to school, so 3 to 5 years. So these people, actually, we have to train them a little bit differently. And they'll be having that fear that, actually, I'll be losing my school, I'll be losing my friends. They have different priorities criteria also. So those things also should be considered, and then we have to take care of them in a different way. But now the real problem comes. If it is an elderly child who's school going, something like a 6 to 12 years, usually these type of kids, actually, they'll discuss in the school also. I'm going to go for this operation. Actually, how it will be, whether actually. Means in the meanwhile, actually, suddenly my one fellow will tell, even I got this operation done. So operation is very risky. It's, they'll be telling their own experiences. So the child may be getting some feedbacks from some of his friends also. Luckily, these 6 to 12 years are the kids who don't see too much of internet, and they won't be googling much. So it's very easy. Teach them little bit about that. Doctor will put you to sleep. Doctor will get rid of your problem because you're having this problem. So we'll get rid of this problem. Try to teach them in that way. But now the real problem comes, that is the teenage kids. Teenage kids are those which are 13 plus. So one child, actually, when I was talking to the mother about the surgery, the child had a phone in his hand, and then actually he kept it under my table itself, and then continuously he's googling. The moment I utter a word, he's immediately checking, actually, what I'm feeling, what I'm feeling. These kids are dangerous. So for these people, actually, we have to deal them actually with respect and with little bit of extra care. And he will Google anyhow, actually, whatever said and done. So, but find out, actually, what is your knowledge about it? What are your apprehensions about it? Let us discuss. So still, over and above the kids, these kids may have a little bit of doubts. So nothing wrong in allowing the pediatric surgeon to talk to them regarding the surgery, so that whatever little bit of doubts are there, actually, we'll be clearing in the knowledge according to which we should give to the family and to the child. We'll give in that way only, and we'll train the child, and then we'll bring him to the. We'll try to win the confidence of the child. Then we'll take the baby inside. Usually, these are the people, actually, if well educated and well trained, they'll be coming to us along with us with more confidence. And because the pediatric surgeon, he is well known, and he knows him very well from the past few consultations, they'll be very happy to come and join with us. So this preparing of the child is very, very important. It's not only pediatric surgeon's job, it is a family's job also. So prepare your child, be honest, and then, but try to make it crisp and simple. Don't try to complicate. Don't try to show him all the complications, all the big things, all the complex surgeries. Pediatric surgery is totally different. What you see in the internet, actually, you won't get pediatric surgical videos also, so or pictures, because they pediatric surgery is a very delicate branch. Actually, we'll be taking very utmost care to give the best possible care, and this comfort is very important, and try to give it, and we'll also give the same. And pediatric surgery, after coming and having a consultation with us, we in our department, we have a workflow pattern. So our after the pediatric surgery consultation is over, first our OP consultation will be done, and then we'll be talking in detail. So that may not be enough. Sometimes the parents want to come and meet again and again. So till all the doubts are cleared, I suggest, actually, a mother or a father should come, even if they don't want to get the child. Also, they can just come separately. So in that second consultation or sometime like that, then they'll be going for what we call it as a financial counseling and insurance guidance, actually, which our hospital team will be giving. and they'll be telling us actually how to tackle. Because as a family, you should be mentally prepared for this financial aspect, also insurance aspect, whether it will be covered or not, all these things. So after the pre-authorization is done, actually we'll ask the child's blood test. That is what is called as a minor surgical profile. It is not like a major surgical profile where we'll be doing ECG, 2D echo, X-ray, all these things. But whatever basic tests are required, that only we'll be doing in kids. And then we'll be going for what is called as a pre-anesthesia checkup with all these tests. And then the pediatric anesthetist is the one who will be deciding your child has got cough, cold, fever, so now we won't do it. So all these things actually they'll be telling, and then we'll be going accordingly according to the workflow. And parents plan surgery for the kid, and surgery date is planned. So in that, actually, we will be sending the requisition through our proper channel, and then analysis, and then that OT day list will be well coordinated, and then usually pediatric patients get the priority. But unfortunately, sometimes a previous day emergency, suddenly they'll just squeeze in between. They may join. So that is when actually we have to give alliance. Something like, for example, on a road, actually, when you're traveling, also, whenever ambulance comes, all of us as a decent citizens of India, actually, we'll try to move to one side and then we'll allow the ambulance to pass. So that is important. In the similar way, emergency operation gets a priority line. So this we should be able to understand. Sometimes actually you won't be understanding. My surgery is given at 10 o'clock. Why it is not being done at 10 o'clock? So that is because maybe one emergency has come, or maybe the previous operation is getting delayed. So these are few things that will be annoying a parent on that day. But as a good citizens, actually you should be able to understand why things are getting delayed, or and there is some delay in the process. So, so when to stop the food, and that we will be telling you, and when to come to the hospital. Usually in pediatric surgery, we don't admit the patient the previous day or 1 day or 2 days before, like how adult is admitted. We just admit the patient and bring the child to the environment only for few hours before the operation, so that child's apprehensions will be minimized. So surgery for the kid, and parents will come to the our OPD again. Actually, they'll be guiding and they'll be taking you to the admission. And then we have a pediatric surgical coordinator number, at least number, at least you can call. Actually, they'll be taking you through this journey, and then they will guide you and literally handhold you and give you some support. As parent, actually, you need so much of support actually to get a child surgery done. It is not very easy. So, but as a pediatric surgeon, I'm used to it. I can talk like this. But as a parent, first time you're getting a surgery done for your child. So it is very difficult. So recently someone was telling, let it be a simple circumcision or let it be a massive, big operation of 8 hours, 10 hours operation. But surgery for their child is a surgery. So we can understand as pediatric surgeons what you're going through, and this is our journey, and we are going to handhold you and take you through this, and then we'll give you the best possible thing. So, but bottom line for all these things is listen to your doctor's advice carefully. Okay. If you have not understood, please come again and then talk to us again, and then we'll be taking you. And this is my team, and we are surgeons for the kids, and we know how to handle newborns to teenagers very well. And this is a pediatric surgeon's prime role. So, with this, actually, I think actually the parents who have some apprehensions in the mind are ready to come for the surgery. And if you still have doubt, please come to us again, and we'll discuss in detail, and we'll be talking about this. So, here some questions are there. Before we conclude the session, we'll just go through it. So, so this is an interesting question. What is the most complicated pediatric surgery that you have handled? So, the frankly speaking, in our pediatric surgery life, every day we'll be renewing and renovating our surgical skills also. So, so I was talking about actually recently we have done on a surgery on a 600-gram baby. 600-gram baby means it's very difficult. It's very tiny, very small. All things are so delicate. So the precision that we should give is supposed to be the superlative precision to the power of precision. Should be like that. So that is one extreme. The other extreme is the latest technology, which is a robotic surgery. Robo means that literally will be docking the child on a robo, and then we'll be doing actually robotic surgery. Some like actually recently we have done one robotic choledochal cyst. So it usually takes around 5 hours of the surgery, but the precision that we are going to give with the robo is extraordinary. You should see to believe, and you should be there to believe it. So this is one of operation that which is very important. So there's one more question: how the pain is managed after the surgery for these small babies? So usually, whenever these small babies, any baby for the matter of fact, their pain threshold is also very less. They can't take pain much. So, but one thing I'll try to add at this for this is the cuddling and the love and affection that the mother is going to give uh, is the best painkiller for any baby after the surgery. And there is one substance called substance P in breast milk, which is supposed to reduce pain in a breastfeeding baby. And apart from this, we'll try to give the best possible painkillers for all the babies. And if at all, if the child is having some kidney problems and all, actually we'll be taking care that we'll be giving only paracetamol. We'll never give actually brufen or any other problem, any other complex painkillers, because those will be nephrotoxic. So we'll be calculating actually whether this is safe for the baby or not. What is the uppermost limit actually that I can give for the baby? So beyond some limit, actually we'll tell the parents, sorry, because we have crossed the limit. We can't give anything more. Just give that love, and that is more than enough. Sometimes actually some kids tolerate pain very well. Some kids tolerate pain very badly. So those people require more love and affection and attention. So this is how actually we should be dealing with the pain. So what complications should we be aware of? This is another important question. But every problem will have complication. Frankly speaking, I am sitting in front of you and in on some electronic devices and electrical devices. So here also in this building, a building can collapse, there can be electric shock or anything. So these are also complications. But despite all these complications, we are just running around. Actually, we are moving on with our lives. So every procedure has got complications. Doctors will explain to you in detail about the complications, but don't worry. My sincere advice as a pediatric surgeon is the moment you stepped into my room and into my confidence, into my care. So taking care of these complications and minimizing these complications is my primary motive. And apart from giving the successful outcome. So that's why don't worry much about the complications. And usually, luckily, the kids healing is very good. Kids tolerance will be very good. Kids uh, tolerance for surgery is also very good. So that's why luckily in children the complications are relatively less. So that is one good part. Uh, so so someone has asked if there is itching sensation and slight redness at the site of the scar after sometime after the surgery. So usually what happens whenever healing is happening, when two things are coming and meeting, so in this healing process also what will be happening is so many actually literally healing factors or healing supportive things will be coming, and then they'll be playing their role here. So in this role, uh, those what we call it as nerve endings. These nerve endings, whenever they're meeting, they will be having all types of sensations. Sometimes they'll be having itching sensation, some will have hot, some will have cold, some will have painful sensation. So whatever might be the sensation, because the nerve ending, fresh nerve endings, cut nerve endings. So these things will go away in a short while. So that's why after the operation is done, usually for most of the operations, as pediatric surgeons, we want to give the best of the best scars. That's why we give some ointments which will reduce the sensations, and along with that, with little bit of massage itself, all the sensations will come down. Sometimes there will be redness. Yes, because of the plaster itself, redness can come, or because of little bit of underlying infection also can be there. If too much of redness, too much of rash is there, I sincerely suggest you go and meet your pediatric surgeon. You come to us, actually we'll be taking care of it. If at all, if anything is required for that. So let me check if anything else is there. Does my child need to gain weight or strength before surgery? Frankly speaking, your immunity is dependent on what you're eating. How much of your healing power is dependent on what you eat. So, for example, if a well-fed baby, his proteins will be good, his healing will be good, and he's ready for a surgery. Yes, some babies actually they'll be very thin, very emaciated, they'll be anemic, they'll be having low hemoglobin, low proteins, and very thin. And frequently, these are the people who have low immunity, and these are the people who will go into recurrent urinary infections, be it cough, cold, or anything. So when all these things are there, definitely their healing power of the during the surgery is also relatively less. So for these type of kids, if unless it is an emergency, we'll advise them to wait for some more time, and then when they're ready only, we'll ask them to come for surgery. So if possible, and as a rule, as for it's advice for all the parents to give good, well balanced diet. It is we all of us read in our science subject. So well balanced diet will have a carbohydrate, fat, and proteins, and most important, fiber. Fiber is there in green leaves, vegetables, and fruits. So these are important. And one spoon of ghee is important, and dal is important. And I'm not telling actually to eat too much of non-vegetarian or eggs every day. So there are many people, many communities who don't eat. It's okay. So those are not the only sources of protein. Proteins are there in our regular dals and regular actually legumes. So give that. So try to see that actually you are giving a mixture of all these things. Now, pizza doesn't have all these things. Outside junk doesn't have all these things. So biscuits, cakes, all these things don't have any of these things. So try to give homemade food with all these ingredients, and then your baby is going to have a beautiful life, and they will be able to take any type of surgery very comfortably in experienced and expert hands like ours as pediatric surgeons who are specialized in dealing with the kids from newborns to teenagers. And this is going to be our promise, and don't worry at all. And this is the message from a pediatric surgeon on upcoming pediatric surgery day, which is on December 29th. And we wish all the kids a happy and a healthy life.